report on the death of Brianna Grier, a Hancock County woman who died after falling from a deputy's cruiser. Records from the Hancock County Sheriff show deputies responded several times recently to Grier's mental health crises. They bring her to a Milledgeville hospital, but her case also highlights the limited mental health resources in many rural counties. Camila Williams explains the problem and how those counties try to cope.
According to the Licensed Professional Counselors Association, also known as LPCA of Georgia, in 2019, there were more than 6,000 licensed counselors in the state of Georgia. I talked with one counselor where rural counties missed the mark. While some counties have the resources to help people in crisis, many others do not.
Some of these smaller counties don't have the amount of mental health professionals that are needed to serve the population.
Jack Taylor is a licensed professional counselor for Caremore in Sandersville. He says the lack of qualified mental health providers in many areas is a concern.
With a bachelor's degree and a master's degree and the studying that I did, I feel that I'm adequately trained to be able to identify a mental health crisis.
Professional Counselors Association shows Hancock, one of Georgia's poorest counties, has 0 mental health providers. Baldwin has 30 and Bibb has 100 providers. Taylor says there's another reason for limited resources.
It's an issue of funding providers to provide mental health care.
Documents from the Hancock County Sheriff's Office show that they responded several times in recent years when Brianna Grier had mental health crisis. They would usually take her to Atrium Health Navis in Baldwin for a psych evaluation. Taylor says law enforcement is not qualified to treat people with mental health problems and they need support.
Mental health professionals are going with the police. I like that ideal of someone going out when there's a possibility that this is a mental health crisis.
I also spoke with Clifford Hamilton at Caremore. He says some rural counties may not know what is available in their area. You can visit your county's local health department to see what resources are accessible. Back to you.
If you or someone you know is having a mental health crisis, you can call the Mental Health Crisis and Suicide Prevention Hotline. That number is 988. It's a 24-hour hotline, so you can call anytime.